an international perspective, disclosure and apology in the UK by Dr. Andy Carson-Stevens in collaboration with the Institute for Professionalism in Ethical Practice.
My name is Dr. Andy Carson-Stevens. I am a clinical lecturer in healthcare improvement at the School of Medicine in Cardiff University in Wales, United Kingdom. In the United Kingdom, there have been a number of serious concerns raised about healthcare quality and safety in the National Health Service, or NHS for short. Most notably in recent years, a public inquiry was undertaken at the Mid Staffordshire NHS Foundation Trust. The inquiry was an investigation to examine the causes of failures in care. As part of a response to the Francis Inquiry report, the government in England has introduced a statutory duty of candour, or put simply, apologising to the patient and speaking up when things go wrong. It means that healthcare professionals must tell the patient, or the patient's advocate, carer or family, when something has gone wrong with their care. Describe what went wrong and the steps that will be taken to deal with any harm caused and what action will be taken to prevent a recurrence. Provide contact details of someone in the team with whom the family or the patient can ask any further questions they may have. And apologise to the patient, most importantly, and record details of that apology in their clinical record. So why do healthcare professionals in the 21st century need to be reminded of their professional duty to carry out what seems like fundamentally good manners, to apologise and try and put things right, and also sound ethical conduct, being open and honest? Well, like in the United States, good people are influenced by the blame culture that can exist to create fear of reprimand and disciplinary action when admitting that an error has occurred. The term second victim has been used in the literature for those clinicians who are traumatised by an adverse patient event. They can suffer psychological distress similar to post-traumatic stress disorder, affecting personal lives as well as professional performance. Although in extreme cases, their distress can even lead to suicide. A recent study published in the UK described contacting all 9 UK-wide professional regulators, covering all clinicians, not just doctors, and a large NHS organisation in the northwest of England, to find out about whether they held any data on how their staff were coping, or whether any support systems available for staff involved in a patient safety incident or under investigation was in place. It was recommended that all healthcare organisations in the UK ask the following questions. What do our staff survey and other information tell us about our culture? And is it improving? What other systems can we put in place to find out how staff feel about working here, and especially how safe they feel in raising concerns? How do we work with whistleblowers in the organisation, however uncomfortable their message? How confident can we be that our support systems actually do work for staff? Do we have a peer support programme? How well do our support systems link with other providers of support? Do we have a policy on supporting staff involved in incidents? And would we know if a staff member committed suicide during or following an investigation or incident? Efforts to improve healthcare delivery have largely been in high-income countries and have predominantly occurred in hospital rather than community settings. In particular, there has also been relatively little focus on child health and paediatric services. The Primary Care Patient Safety Research Group at Cardiff University in Wales, United Kingdom, is working to identify learning from patient safety incident reports involving children. Using data from a national reporting system, our work aims to characterise the paediatric safety incidents occurring in family practice. Useful lessons can be learned from these reports. The majority of opportunities we have identified to date centre around more effective communication and teamwork in healthcare. The multiple contributory issues resulting in those communication breakdowns can be identified. Presenting back to healthcare professionals the learning summaries and ideas for development to test and eventually implement in practice, though, is key. Patients need us to speak up, share, and to learn together.
Reflective exercise. Please post your responses on the comments board for this video so that others may learn from them.